Hi, ever wonder what it's like to work another profession or live in the underworld? Listen to unsuspecting riders give a 10 to 15 minute personal masterclass as I spontaneously interview them as they enter my taxi. I'm your host, Simon Rushton, and this is Taxi Chronicles. Morning. Yes, we're back with another episode, another rider. Today we have a lovely lady all the way from Ireland, and she's a specialist in the dental industry. And she's been educating me about the dental industry with words I do not understand, but I'm sure my lovely daughter will. And so this is actually one for you, Akila. So you can get more of an insight into why Daddy says go to King's University. Nice to have you here today. Just look to that.
Yeah.
So, let's just start. How did you get into the industry?
I just kind of fell into it. I was doing regular nursing, and then I did a summer job, dental nursing, for like a local dentist where I'm from. Mm-hmm. And I picked it up really quickly. So then he suggested that I should try and do dental hygiene or dental therapy. And at the time in Ireland, they'd only accept like 14 people a year, so most people spent a few years applying, trying to get in, but I applied and I got in kind of straight away.
Okay.
So I did that, and yeah, I don't know, it's dentistry, like you get to talk to loads of different people, and learn all about them, and I was interested in the aesthetics and the mouth and all that, so it's that's kind of why I fell into it. And actually it's a really good job to travel with, so I ended up going to Sydney in Australia, and I got sponsored there by a dentist, and I worked there for 7 years.
Okay.
And then I came to London and worked for Oral-B until today. Today's my last day, so I did 5 years here.
Okay. So what was it like working in Sydney in the dental industry?
It was great. Like, it was hard work. They worked very long hours in comparison to here, yeah. So it was kind of 7 a.m. to 6 p.m. Monday to Thursday. But then Friday you finish at... Yeah, you finish at like lunchtime, and, you've got the nice weather, and so everyone kind of goes out then all weekend, and yeah.
So it's a long weekend, but you put in the hours in a week.
Yeah, 100%.
Yeah. That kind of probably suits their lifestyle more.
Yeah, it's a good lifestyle, really good weather, good quality of life. Yeah, it was great.
Did you find that the dental industry was different or more advanced or any way there?
Yeah, so pretty much everybody has private health insurance in Australia, and so dentistry is all private basically. And the health insurance system over there it's better for dentistry in that a lot more is covered, even on a basic insurance plan. So it basically means that people they're not just getting fillings, they're getting crowns and bridges a lot more frequently than they are over here, because a lot more is covered by their insurance. And then that obviously means that revenue is higher, so like dentists are actually earning more money there than they would here. Mm-hmm. Which means then they can invest in better technology for their surgery. So we were using 3D scanning machines like years and years ago, before they were commonplace here. Mm-hmm. So yeah, it's a really good, like if somebody goes off and does dentistry, like your daughter, it's a really good place to go and then work, because you learn loads, and yeah, it's brilliant.
Okay. So when you came to London,
yeah.
Oh, sorry, did you do any training there, additional trainings? Because
I didn't change my role or anything, but yeah, there was lots of training courses. Like I worked for a really good dentist that would send me on any training course I wanted, so yeah, I did lots of training around Australia and like various states, and that obviously helped me then move into a more corporate role in dentistry with Oral-B. So yeah, it was really beneficial.
What kind of courses are available? So what I'm getting at here is, once someone's graduated, what additional courses would you recommend? I know you've got different sections of the dentist industry.
So it depends on kind of what treatments you want. So like obviously I did dental therapy, but like I didn't do dentistry. But if I were a dentist and I was, you know, qualified and wanted to do extra things, for example, if you decide you want to do implants, you know, you can go off and specialize. Obviously, you can go off and train as a periodontist, spend an extra couple of years in university, or like working in a hospital like Guy's, St. Thomas's or King's, and then obviously qualify as a specialist. If you're just a dentist and, you know, you didn't really want to go down that road, you could go off and get training in Invisalign, so you could provide Invisalign to your patients. You could go off and do some implant training, so you could do implants. There's myofunctional orthodontic techniques as well. Like I've done a course in that. There's loads of different avenues you can go down.
So what I'm getting from you, and obviously I'm very layman here, is it's like a doctor where you could be or a surgeon where you could be a specialist in I don't know, limbs or neurology or
exactly.
Okay.
It just doesn't take as long. There's loads and loads of different options. So there's kind of jokes in dentistry, like the jocks do oral surgery, you know, and then the people that don't like blood do orthodontics, and you know, so but yeah, there's loads and loads of different specialities. So
so if you find that you haven't got that strong a stomach, you can still stay in the industry.
So maybe ortho might be a better option.
That makes sense. So you came to England. Obviously you spoke about how life was great in Australia, social life and everything. What was you spoke about the differences. How far behind, should I say, are we?
Oh no, look, we're not behind at all. It's just that in the UK, like, we've the NHS, so you have like NHS dental practices, you have mixed, then you have private. Australia is pretty much 99% private, all the dental practices. So it's just that there's more, dentistry tends to be private there. Over here it's very mixed. So your private dental practice will probably have all the same equipment that a private practice in Australia would have, but obviously your NHS is not going to provide you know, certain levels of treatment. Okay,
I'm with you.
But as regards training, I'd say that people that train here and in Ireland are the best people trained to dent. I just think that the training here and in Ireland is better. I think it's the best in the world.
Oh, is it?
I think so, yeah.
Okay, that's interesting. Good to know.
Like if you go from here, Ireland, to Australia, or anywhere, to be honest, and you've trained here in any form of dentistry, like hygiene, nursing, general dentistry, you're quite highly regarded, and it's quite easy to get sponsored and all that. So so I just think that private health insurance is it more of a thing there than it is here, and that's the kind of difference.
I know you spoke off record to me about this before, but what kind of your role? Can you just explain what your job is and what you do?
Well, so up until today or yesterday, I was working for Oral-B. So my job was basically to go and kind of provide education to clinicians. So if you're a dentist and you're trying to figure out what to recommend to a patient with, you know, gum disease, I would explain like how Oral-B brushes and paste works, and patient by patient. So like, you know, tailor what I'm explaining to them by patient need. So I'd give them obviously in-depth information on exactly how all the, you know, how the paste works chemically, and then obviously how the brushes work and how they can help teach their patients like how to brush properly and all that. So it's very much kind of an educational role, but then it's also to provide support. So again, if you're a clinician and you have a patient that has some kind of oral hygiene issue that, you know, they're having problems dealing with, I would have people contact me and say, I have a patient that's suffering with X, Y, and Z, and what would you recommend? And then it's a matter of them understanding how the products work and then be able to recommend it with that kind of scientific knowledge. Okay,
that's good. What do you say you've learned that you wish you knew when you had started?
About dentistry?
Yeah.
God, I don't know.
Okay, that's the first time I heard that answer. One thing, just to jump in there, you said something that fascinated me when you spoke about how the different toothpaste works.
Yeah.
Because I was having, it's like a toothache or something, and I went to the dentist and he said you need to change the toothpaste.
Yeah.
Because your gum is retreating from I've got lots of crowns. And I never knew that difference. I was doing this herbal toothpaste. I saw on the internet that someone said there's this thing, a colour scheme, where black is real chemicals and green is like a herbal toothpaste. You probably know about this.
I wouldn't touch that stuff.
What, the black?
The herbal stuff. I wouldn't go near it.
Really? Why?
No
Why is that?
way. You need fluoride, and you need something that's, like there's lots of problems with medical products where like things aren't regulated tightly. So like all these companies that don't know what they're doing can, and obviously I'm not naming any names. I don't even know what company you're talking about. They can sell, toothpaste or like healthcare products and market them as they're going to do X, Y, and Z, but like there's no scientific basis behind it. Like you want something that's, through like a reputable brand that's been peer reviewed.
Yeah, longevity.
But like not all toothpaste are created equal, so you obviously need a paste with fluoride in it, but then people have different issues. So some people have sensitivities, you'll need a desensitizing toothpaste. Some people have issues with their gums, you'll need something that reduces inflammation. So yeah, what you need is for, to ask your dentist, your hygienist, like, what specific toothpaste or brush they recommend for you, because everybody has different needs. And that was my whole job, was like identifying that and making sure that people were aware that like what you will need will differ to what I need. Like I don't have any recession, so I won't have like bits of sensitivity that you'll have, but I might have a different issue down the line. I could end up with like bleeding gums, then I'm going to need something else. So
okay. And what does fluoride actually do?
Fluoride does a lot. Like, it remineralizes. So like basically you can get if you're having a lot of like acid or sugar in your diet, you can kind of get kind of fluorosis. So it's something that's going to start to develop into decay potentially. If you're using like a fluoridated toothpaste, that can actually stop that process happening. So it can remineralize your tooth. Basically, when you're starting to get decay or damage your teeth, it's basically demineralizing the enamel in your tooth surface. It's making it weak. So a fluoride toothpaste then can remineralize it, so it can kind of get it back to what it was. Now, obviously, you can go to the point where it's too late and you need like intervention, but fluoride does loads. I could be sitting here all day describing what it does, but trust me, you need a fluoride in your toothpaste.
I understand, because the dentist actually told me to get it on my finger and rub it into my gum.
So that's desensitizing.
And then it started to go away. It just grew. I think I don't know whether it's growing normally or whatever, but the problem stopped.
So what was there? So what you were probably recommending was a desensitizing paste, because if you're rubbing it in topically, it means it's an instant action, and an instant action would be a desensitizing paste, one that numbs. So yeah. So
the best really thing is to go to either your dentist or your hygienist, and when he looks at your teeth, you say what toothbrush or toothpaste do you recommend, and are electric toothbrushes good for all ages? Because I know I was told that my son, who's very young, he shouldn't have it yet.
How old is he?
He's 4 now.
Yeah, he'd be okay with a kid's brush. They need to be supervised brushing till they're about 9.
Okay.
Because otherwise, you've got some kids that will brush everywhere, but look, their dexterity at that age isn't going to be amazing, so they're going to miss patches and so you need but they from 3+ they can use an electric toothbrush. Now 3 to 6 they still have their baby teeth, so there's a specific kids brush that has like a smaller head, because basically the round heads that go with say Oral-B brushes, they're designed to cover the tooth surface. So there's a bigger head for your adult teeth, obviously, than there would be for...
Okay.
Yeah. But yes, everybody can use an electric toothbrush, and what you need is an oscillating, rotating one.
What's that? What? Sorry.
Oscillating, rotating. So basically it's
Goes
rotating, but then it also creates a pulsation. You don't want back and forth. Back and forth isn't good. You want circular motions.
So they all don't do that then?
No, they're not all
you want
created
circular
equal.
motion, but going in and out.
No, so it's basically you need oscillating, rotating. That's the only technology that's proven to be more effective than manual, and the brand that does that is Oral-B. There are other brands in the market, but they just pulsate or they vibrate. That's not producing a directional change.
So Oral-B electric toothbrushes do the pulsating.
Oral-B brushes, they oscillate and rotate, and they pulsate.
That.
Yeah,
they all. That's a standard for them.
Yeah.
Okay, so I don't need to. I was just about to go and buy a new one.
So you don't need to get a top of the range one, but you want one that has a pressure sensor, like a red light that flashes if you put too much pressure on.
Oh yeah.
Especially for you, if you have recession, you want something that will just tell you if you're brushing too hard.
What would couple of last questions? What would be your advice to a person who's coming into the industry, career-wise?
I mean, this kind of sounds a bit silly, but I would make sure that I was, very careful about my posture, and that I did a bit of research on ergonomics. So obviously it sounds very trivial, but this is actually really important. If you're doing dentistry, you're leaning over people, you're bending over all day long in a chair, and you need to make sure that keep yourself kind of nice and, fit as regards stretching and all that, and make sure that you're that you've just kind of talked to a physiotherapist about things that will things that you can do that will stop you getting any injuries. People end up with carpal tunnel, or you could end up with damaging, hurting your neck or whatever. So I would look into all that stuff in advance and know what I need to be able to work in a safe way, where I'm not going to put damage or stress on my body. The other thing is, look, obviously there's a lot of study involved, and you have to be, when you're working dentistry, you're working as part of a team. Like, a dentist can't really work without a nurse. So you want to make sure that you're happy to be kind of working in that. You're working in close proximity with people all the time. But yeah, I would say that a lot of people end up with back issues and things like that. So it's good to be, before you even begin, to be aware of all that and have kind of come up with a plan as to how you're going to, counteract that or stop it from happening.
So take up yoga or something.
Just be aware of things you can do to make sure that you're keeping your back and your neck and everything nice and strong and healthy.
Yeah, I understand that. Last two questions. If you could do any job in the world and money wasn't a factor, what job would you do?
I'd be a speech pathologist.
A what?
A speech pathologist. So basically, it's like a speech therapist. My favourite types of people are elderly people and kids. So speech therapists and pathologists would work with kids that maybe have issues learning how to speak, or things like that, for various reasons. So, and the thing is, because of my profession, I did all the anatomy of the muscles in the head and neck, so I understand how all that stuff works. And then obviously you'd be working with not just elderly people, but maybe people that have had strokes, for example. So you're getting them to learn how to speak again and learning how to use their muscles again. So I think that's something, to be honest, if somebody was willing to give me money to be able to live and go back and study and do that as a degree, that's what I do. Okay, I'd love to do that.
That's interesting. There's a bit of a trick question. Before we used to ask if you could do it all again, would you? But now I ask that question because it covers that question.
Yeah, but
go on.
Things are working out. They're working out.
Yeah, no. Yeah. It doesn't mean they wouldn't be working out, but you know what they say, the truth to true success is to do something you really love and get paid for it.
Well, I love what I do now.
That's good.
And look, obviously I would have liked to have, looking back now, I didn't even know what that was when I was going into university. I didn't even know it was a thing. But like my doing what I did, it's changed my life. Like when I first went to Australia, there was loads of Irish and English people that I met my first year, and there was only a couple of us got sponsored, and because I was in dentistry and that was on the list of professions they needed, I managed to get sponsored and I didn't have to leave. So that totally changed my life. So I've ended up being overseas for 12 years. I'm going home now after 12 years. And like when I left home, I thought I was leaving for a year to ride out the recession. So yeah, I think that it's not how I thought it would work out, but actually I'm really pleased that I got to, spend 5 years living in London, which is like an amazing city, and then 7 years in Australia. And I met my partner over there, and we're moving home together now. And yeah, so I've no regrets.
Okay, that's good. And last but not least, the question I ask everybody is, what's the impact you want to have on the world?
God, I don't know. Well, obviously I want to have a positive impact, but like my impact is going to be in a very small circle of people. So obviously I just want to, I don't know, like look after the people around me and my family, and I suppose make the world a better place by encouraging people to, have good oral hygiene. Yeah. So yeah, I don't know.
That's your gift to the world, really. It is. It's your gift. You're making people have a happier smile. I will push this out to everybody I know who's got bad teeth or who wants to be in the dental hygiene business, and they will be very happy. Yeah. But anyway, thanks a lot for that.
You're welcome.
I appreciate that, and we wish you well on your return home.
Thank you.
We hope you liked that interview. Don't forget to like, share and subscribe to get the latest daily episode. Ever considered investing in the continent with the fastest growing economy and population on Earth? The same continent that holds 30% of the world's known natural resources? Then listen to our sister podcast, Africa Investor Stories, where you will hear real investors with real stories from around the world share their experience of investing in Africa. We post Monday and Thursday at 10 a.m.